All right, and welcome to episode 8 of Modern Prescription.
Wow, this is a good one.
This is a really good one. We're talking about depression and how it's affecting people, treatment options, and are we over-treating depression in the younger patient populations?
We talk about how having good hair makes you feel good.
Yeah, and what Dr. Toll does with his hair.
I'll share my regimen, and we get enough questions.
Yeah.
Give it away.
And if you have thinning hair, what are some options, and what do we prescribe for our patients?
Yeah.
And we'll also talk about Michelle Obama and her admission of depression. We'll talk about...
I have a cool mystery case this week.
Oh, a really good case we're going to talk about. And why you should definitely wear a mask.
And then we're going to talk about why you need to share the show and your disservice to America.
Yeah,
if
for
you
not
don't
sharing.
Share the show.
We have to. And God bless Lebanon, and prayers to all the people going through what they're going through there.
Enjoy.
Thank you, guys. Welcome to episode 8 of Modern Prescription. My name is Dr. Deepak Dukar. I'm a facial plastic surgeon in Beverly Hills.
And this is Dr. Toll, the internist / COVID collector.
/ happiness doctor.
I like to be happy.
Always happy.
It is a hard time.
It is a hard time. We were talking earlier about hair. I want to bring that in. So how long has your hair been this long?
Well, I cut about 6 inches off. I think at some point in the pandemic when I was just feeling too cooped up.
Yeah.
But it's getting long again. I don't know how that happened.
Home haircuts. Everyone's doing home haircuts. What's your tips?
Yeah, this is what happened. So when I was in college and I had no money, I used to shave my head with like a clippers.
No way.
And I played soccer, and a couple of my teammates were like South Americans with long hair and stuff.
Oh, that's cool.
So I grew out my hair it was at least a year where I didn't cut it. I just didn't cut it from shaved to long, and had the ponytail, and intermittently brought it back.
That's awesome. Did you have long hair in med school?
No, in med school, I went to Jefferson in Philadelphia.
Oh,
so
great school.
You have to wear a tie. You have to, you have to shave. I didn't have the beard.
I don't know if you know, my brother and sister both went to Jefferson.
I didn't know that.
Yeah, they both went to Jefferson. You guys probably didn't overlap because they're older than us, but they both went to Jefferson.
Wow. Yeah, no, Jefferson's a great hospital,
great hospital. Oh my God, one of the top institutions.
It's the first medical school in the U.S.
In the U.S., yeah.
The hospital's fantastic in Philadelphia. It was a great learning environment for me, but I'm glad to be back in L.A.
Yeah, Philly was cool. Where'd you go to undergrad? Here at USC, right?
USC, yeah.
And then at Jefferson. Wow, that's dope. So I was at med school at George Washington in D.C. Yeah. It's not too far, 2-hour train, right?
I have 2 friends that are orthopedic surgeons there now.
Oh, at GW.
One is the spine doc there.
Cool.
And the other, I think, just general sports ortho.
You always just...
They're a married couple, actually.
Oh, really? Yeah. That's so cool. Yeah. You always gravitated towards ortho in general.
I thought I was going to do ortho.
Yeah, I remember you telling me that.
It was not for me.
What are your hair tips for people trying to cut their hair?
There's no COVID testing in ortho. So
that's true. You wouldn't be COVID.
General hair tips. I do a lot of the things they say don't do.
Really?
So I only wash my hair with I shower 1 to 2 times per day. Probably, but I only shampoo it once per week.
Oh, wow. So you have a lot of natural oils in your hair.
Natural oils, I believe in.
That's good. Yeah.
I also believe in the ocean making your hair somehow better.
Nice.
So I'll go in the ocean. In the summer, it's honestly probably once a week, maybe once every other week.
Yeah.
And then I'll leave it in there. I'll shower, but not shampoo necessarily.
So some of that salt, some of that. Yeah. That's really cool.
That's how it kind of binds itself.
I love it. Well, no one can argue with your hair health. Nobody can argue. You have more hair than most 20-year-old guys do.
Thank you.
I love it. Well, that's all we're going to talk about this episode is hair health.
Yeah. Well, it's funny because a lot of guys, friends, patients talk about starting on Propecia or Rogaine and all these things.
Very common.
And then a common side effect for a lot of them is, sex drive problems and erection problems from the Propecia.
Yep.
And so I'm happy to not have to worry about that.
Yeah, it's common. I see a lot of patients for hair loss who wanted to potentially try PRP. So platelet-rich plasma, where you draw the blood out of the arm, spin down, get the platelet-rich plasma portion of it, and then we inject that into the scalp to sometimes give thicker hair. And it works pretty well. Some of the times. And that's kind of the caveat that I tell all the patients, because it's not it doesn't work. It does work pretty well, but some of the times it just truly depends on whether you're platelet-rich plasma is effective or not. Some people's isn't as effective. And I found younger patients it works a lot better. But older patients, the older you get, I feel like your platelet-rich plasma is just not as efficacious.
Is the reason it doesn't work the plasma isn't good enough, or is it because you don't have the hair follicles anymore?
So a mixture. So if you don't have the hair follicles, like if you're bald, PRP is useless. Like, so if you're listening and you're bald and you've been thinking about doing PRP, don't do it. Total waste of money. But if you have good follicular density, is what kind of how we describe it, and there's enough follicles per square inch, then you probably could benefit from PRP if you have decent plasma. So that's the plasma strength.
My layman's understanding is how this works is when you spin the blood down, the platelets have a lot of growth factors.
Yeah, growth factors, exactly.
And so normally the platelets are talking to each other to make a clot in the body, but when you put them in a specific place, they talk to whatever cells are next to them. They're just secreting that cytokine.
Exactly
and that tells
right.
the hair to grow.
That's exactly right. The cytokines and interleukins that are being secreted, instead of self-communicating, they're now communicating. And that's why PRP is used in the joints. Everywhere in the skin.
I remember when Kobe Bryant, RIP. Speaking of episode 8, number 8.
Number 8, the legend.
I remember when he went to Germany, I guess this was maybe in the early 2000s.
Yeah, I remember.
When he had a knee injury.
Yes.
And he had some PRP done. And that was like the first I had heard of it.
Right, me too. I remember
and now it's really interesting. A lot of the orthodox that I work with, they will tell you the same experience. I can't predict what it's going to do for you personally, but they've had instances where either PRP or stem cells or all of these things, you inject it in the joint, and then sometimes miraculously they're fine again.
Right. Because it kind of re-heals the cartilage of the meniscus. The PRP is interesting. And I have a lot of women who ask about PRP also, because women hair loss is so annoying for women to deal with, because they can't, it's not the same as like guys where we can just thin hair, shave our head.
You still look like a guy.
Yeah. With women,
but aren't they using PRP for like skin and stuff too?
Yeah, PRP on skin. Topically, we use it. We do micro needling with PRP. It's like famously known from Kim Kardashian once did it on a TV show, that Keeping Up with the Kardashians. It's called a vampire facial, what they did. And there's this doctor, I forget his name, but he has trademarked it. So you're not allowed to use the term vampire facial.
A smart guy.
Yeah, super smart. He
is he licensing it? At least is he smart enough to license it to other doctors and not even work anymore?
So he is. What he did actually, and he sent legal notices to everyone who were using it. I think he scoured the internet. Anyone who's using the term, he sent legal notices. And he actually was kind of respectful. He was just like, hey, just letting you know, I own this term. We don't want to have any trouble. You have 2 options. Please stop using it, or please join our team, and we'd love for you to license the term from us.
Wow.
Yeah.
Genius.
So really smart. And I think he got into like a legal battle with the Kardashians too. I don't exactly know how it was resolved or what happened, but because I think they use the term vampire facial, and technically that's he owns it.
That's incredible.
Yeah. So
smart.
But so people are using PRP in the face, PRP facials, and people are using it in the hair to make hair thicker. My experience is that in women, it doesn't work as well as it does in men. Like I've treated probably 200-300 patients now with PRP in the hair, and I would say women not as well, older women definitely not as well. Younger males, amazing. Like it's amazing. Yeah,
really?
We mix it with a topical, instead of Rogaine, which is minoxidil, 5%, we mix minoxidil with a topical retinoic acid, 0.025%. And the combination together, the retinoic acid thins the skin just a little bit, so the minoxidil gets deeper absorption. And we find that works like crazy.
Wow.
So minoxidil with retinoic acid plus PRP, it's amazing. Like
you probably just got like 100 of my patients.
Yeah, that's funny. Yeah. It works really well. It actually really does. But that's the combination for men. Young guys, it works amazing. Girls, it's a little tough. Like I have a lot of female patients who do PRP and enjoy it. But it's just not as robust. With guys, sometimes it's just so robust. Like I have guys who've been doing PRP once a month for like 6 years now. Wow. Like they come monthly.
Last that long.
Yeah, they just keep coming every month. They just keep doing it because they're just in love with the results. And I think that it's a lot of the stuff, the biotin, oral supplements, I think helps a lot. I think it's like we talked about this in a previous episode. What we put in our bodies makes a huge difference.
Of course.
And a lot of it can be negative. So it's interesting to hear that you say you only shampoo once or twice a week, because I shampoo twice a day.
Twice a day.
Twice a day.
No.
I know.
And you lose all the oils.
I know. And I feel like my hair is always super dry. And I think you're right. I think I'm shampooing too much.
Yeah. You know what? There's a transitionary phase if you stop where it'll look disgusting.
You have to go through that?
You gotta, like, for a month or two even, where if you're shampooing twice a day and you want to try the other way, it's going to look gross. You're going to look like you just woke up. You should still shower, wet it. Wet it.
Yeah.
Just no shampoo. And then your hair kind of like gets used to it, I think. I don't know what that even means, gets used to it, but it just seems to do that.
Wow, that's crazy. So I'm shampooing about 10 times more than you.
Probably 13 times too many per week or so.
That's amazing. Well, we're going to find out. We're going to ask.
Works.
Yeah. Well,
I guess I could try washing it twice a week and see what happens.
I'm going to try not washing it.
Should we go opposite?
Yeah, let's go opposite.
Yeah, we could try that.
Because worst case, even if mine looks oily, I can put a surgeon's cap on and just go through my day.
Those are cool.
Yeah. It looks cool. Yeah, I like it.
I don't have anything equivalent.
But yeah, hair loss and haircuts. It's a weird time right now for both of those.
Are people still wanting their hair better even during COVID right now?
Yeah, people, it's funny right now, it's kind of an uptick in cosmetics is what we're noticing across the country. And it's because people, God bless the people who are struggling and financially and with disease, but people who are doing well and have a little bit of earnings that they want to spend, the cosmetics take an uptick because they kind of find like it's a good time. No one can see them. They can recover.
I think they're treating their depression.
Yeah, I think that's probably a mix of it. You're right. Something to do.
Boredom, yeah.
Yeah, it's like when my wife or
someone needed a procedure.
I know. But it's like when my wife sometimes will buy something and she gets instant happiness. Yeah. And I'm like, wow, how does that work?
I'm just finding so many people. Like this week, I don't know what it was about this week, but I think almost every day there was just a depressing story of someone who's just isolated. These people in their mid 70s, early 80s that whether or not the spouse has passed away or just, they're single or whatever it is. And they're so isolated because they're scared for their life.
Yeah.
They can't see anyone. They can't see their kids or grandkids.
Right.
They're FaceTiming with people, but they're isolated. It's just, there's so many sad things going on. What is going on?
I know. What do you suggest for your patients?
Bombs are going off.
Oh my God. Yeah, we'll get into that. Lebanon, what's going on right now? That's so sad, so depressing.
So what am I doing for my patients? I'm trying to get them back on as much of a routine of wellness activities that they can get. So if someone's not working, if they're in their 70s, yes, you can walk outside in this, take a walk, get outside of your place, stop watching the news.
Yes. That's
huge. You can do other wellness activities. So, write a list of what you're grateful for before bed and then read it first thing in the morning before you look at your phone. Think about some of the things in your life that you're really proud of.
Yeah.
Think about some of the, your children and you're proud of their accomplishments. Just to remind yourself of you've lived this life of this many years and there's been so many great moments in there.
Yeah.
And right now is not great really. And it's out of a lot of our own control, but to try to remember the good times if you can.
Yeah, totally. I totally agree. Now
and get some PRP in your hair.
Yeah. And maybe just don't shampoo for a little bit.
If you don't shampoo, it's going to be great hair. I think that's helped my hair not fall out because I don't put product in it.
Yeah. That's what I was going to ask. No product either.
So there's no alcohol. Cool. There's no.
Yeah, I don't use any products
gel.
In my hair either.
There's just.
I've never used gel
greasy,
in my hair.
I haven't washed it for a while.
I love
That's the product.
I love it. Well, back to your comment.
I should jar it maybe.
The natural ocean.
And sell it as a product.
The oils plus the ocean salt. That's actually a good idea.
Thinking about it.
Yeah, we'll call it modern prescription.
Yeah.
The modern hair prescription.
Yeah, that's great.
But to your comment earlier about the elderly, I think the other point is that for the younger people, we all feel like we're all going through this together, so we kind of don't need to reach out to everyone. Yeah. But I feel like it's so important for us to reach out to everyone, like especially the elderly in our lives, calling our grandparents, our uncles, our aunts, our parents, and just being a little bit more involved in people's lives than maybe we were before. Yeah. Like if you only called your grandparents once a month before, maybe now it's a good time to call them twice a week, and just check in with them.
Because it's huge for them. These are what they look. You don't think about it because you're not in their shoes.
I know.
But especially, if it used to be that they would have brunch with their friends once a week, and they didn't have that many activities, but they were doing something else. They may volunteer, a lot of people who were working in their 70s can't go to work anymore.
Right.
So even if, they were just having social interaction at work. So it's just, a lot of people are saying, I used to see my kids and grandkids every Sunday we had a family dinner.
Yeah.
And that's now gone because there's a 5-year-old and 6-year-old in daycare and it's just too dangerous.
Right.
And then they're depressed.
Yeah, no, I agree. So at least, call your parents, call your grandparents, call your uncles, call your aunts, make some time for them. It's important because like you said, that's something they look forward to, even though for you, it seems like a burden for the moment. And once you call them, it's never a burden, but, make a point.
I think I've been writing more, antidepressant scripts recently, for sure. But I'm trying to pair it with some homework assignments to try to perk them up too. I think they need to do something with it.
I like
the
that.
meds aren't going to just do it alone.
Right, I like that.
And I usually try to I'll double check in. So we'll start a med, you have a homework assignment, we're going to make sure you're doing whatever we're saying you're going to do, like in a week to 2 weeks. We know the med's not going to start working for 3 to 4 weeks at least.
Right.
And then we can start talking about adjusting the doses and stuff like that. But you got to do something with it, whether it's work out, I'm going to walk, I'm going to start reading. I've talked about this before. Everyone has their own thing that relaxes them, or is there a hobby, or is there joy? If they liked, baseball, watch a game or whatever.
Right.
I used to collect baseball cards when I was a kid. Why don't you pull out your collection?
Whatever
it is, do the thing that you're going to do. The meds may help, but you got to change something.
Right.
It has to be that move gets the boulder rolling.
And for someone who maybe is feeling depressed or sad once in a while, when should they think about meds, or how does that conversation come up?
I think being open with your doctor and having a reasonably close enough relationship to have an understanding. Because I think a lot of times, if you have a good relationship with your doctor knows you well enough, and and especially your family knows you well enough to see. You could ask your family maybe, or if that's helpful. I think without there being a judgment of, but I think the definition of depression in a book is different than necessarily how someone feels or how long it's been going on.
Right.
And then there's always, is it situational based? Then it doesn't not count as depression. So let's say your family member got sick with COVID, is in the hospital, and you're sad.
Right.
That's normal.
Yes. You may not need to be on Lexapro because of that. Yes.
That's normal. If this has been going on for months and it's changed how you live, meaning you don't work, you can't get to the house, you're like truly like a different person.
Eating habits have changed, eating too much, eating too little. Yeah, that's a good point. And the other thing is, like, everyone's affected by it. Like, Michelle Obama just admitted that she's been going through some depression lately, whether they call it low-grade depression, whatever that means, but just having lower symptoms of depression. And she attributed hers to the quarantine, to dealing with this current presidency and just all the fun that came with it. And then the third one she said is all the heat and responsibility they feel from the Black Lives Matter movement right now, and all that's kind of put on her and her husband, the great President Barack Obama. But I think that when it shows you that no one's immune to depression, no one's immune to this.
No, not at all.
She's one of the most influential, powerful women in the world. Rich beyond wildest imaginations, and yet still depressed today. Yeah,
it's hard. It's part of it's chemical in your own brain, and it's just hard. It's hard to know what it's like to be in someone's brain.
Yeah, that's 100% right.
No matter how well things are going for them. Right.
And it's all how you view it and how you interpret it, and we all have that fallacy of interpreting things well and not well, depending on the day. You'll have the same exact day with the same number of patients, and sometimes it's an awesome day, and sometimes it's a stressful day. And it's the exact same day.
It's just
it's how you interpret it at that time.
These little interactions or these little things.
What's the most common first prescribed antidepressant? Is it still Lexapro?
Lexapro the connotation with it is it tends to help more with like anxiety-based depression. So if the predominant part of the depression is being super anxious, Lexapro. Then if it's more sadness-based, I think people will reach for more like Zoloft or some of the other ones.
And do these cause sleepiness?
Not really. Not necessarily.
These aren't drowsy medications.
They don't make you drowsy. Some of them will say take it at night just in case, but it doesn't particularly make you drowsy.
And what about the thought of taking like Adderall as a depression medication?
So I don't love the amphetamines, the whole class in general. They have their uses. I find that they tend to cause a lot of anxiety and insomnia.
Got it.
And sometimes it ends up leading to this. One of my main teaching points to my residents is not to treat side effects of a medication with another medication.
Yeah, great point.
And you will tend to find a lot of people who are on Adderall are also on Xanax or Ativan.
Wow, yeah.
Because they're too anxious. And so if it's someone who's not, if people have severe ADHD, I'm a little bit of an anti-ADHD as a diagnosis. It's not that I don't believe in it. I just think it's
diagnosed.
Overdiagnosed.
Yeah.
So if someone truly has it where they really cannot focus at all, it can help people, but then they still have to deal with the side effect of you're giving them amphetamine, so they're going to be anxious.
Right.
But it may be worth it if it's severe. Whereas all these people who are like, really, they're using it as a enhancement to study better.
Right.
If they start taking it every day, they're going to get anxious.
Got it.
Especially if they don't really have ADHD.
Right. That's interesting. And what about people who just take it once in a while? Like I remember in med school, there was kids who would like take it, or in college people would take it before exams or something.
I mean, to me, it makes me feel so antsy. I hate it. I tried it for like medical school exams. Like after the first time I stopped using it because it made me feel,
naturally energetic.
It made me antsy.
Yeah. You don't need it.
I'm super focused. I can focus for I have like reverse ADD. I can study, focus, or read for hours, and then I look up and like hours have gone by.
Wow, amazing.
But it helps people. I mean, it works. It's just a matter of, is it worth the side effects, which is a fair conversation to have.
Yes.
So if I have that conversation, again, I'm one of those doctors that I think it's just the informed understanding of the patient to understand, like, listen, I may be more productive at work. I may be more anxious and have some insomnia, but that's a trade-off that I'm willing to take. Okay, sure.
Right. As long as you're willing to take that trade-off,
But understand that, and it's not going to cure your depression per se. It may make you get shit done and change the juju. So you've been down and you can't get out of bed and you're tired. So maybe a little Vyvanse, Adderall, something may get you moving a little bit.
Jumpstart, yeah. So
there's a role for it. Just I don't love it. It's not one of my favorite.
Right. I have a lot of younger patients doing rhinoplasty. And so, 16 to 20 I do a lot of patients. I see so many of these kids and they're beautiful, nice, charming, wonderful. And they're all taking Adderall or Vyvanse, and they're all taking Xanax at some point. It's that's not, to me, that wasn't like how we grew up. Like we didn't get medications when we were kids.
I remember in medical school at Jefferson, and I actually got in trouble for this. The pediatrics professor was teaching us about ADHD. And I stood up and I said, how are you as a doctor meeting a child once when they're 7 years old, 6 years old, deciding that this person's going to be on amphetamines for the rest of their life?
I love it.
I was off the wall when I was 6 years old. I was so loud and crazy. I would get in trouble for talking in class.
And never got meds.
No, God no. But that makes me like, that's my best quality.
Right.
It would have been ruined by that.
Right.
And so it's something I would never, I'm not a pediatrician, so I don't get into this, but I would not prescribe it to children, really, unless they're absolutely severe. But it's these parents, it's the same type of parent who is cheating for their child to get into USC.
Tiger parents,
That, they may get from a B+ to an A- on Adderall, but you're also going to make them anxious for the rest of their life.
Right, yeah. I think that's a great point, because I do see that a lot now that you're saying that. Adderall and Xanax. I see that on my medication list many times.
What I always try to tell, and because I have patients who are like 18, 19, 20 in college and wanting to get better grades and whatever, and I try to explain them that you're doing yourself you will do slightly better.
Yeah.
But in the long run in life, probably worse, because you're not learning how to manage your time. Like, all these people want a shortcut. So, hey doc, can you write me a letter to get extended time on my bar exam?
Yes.
It's like, okay, fine. Let's say we do that. When you have a trial that you have to prepare for, you don't get extended time.
No.
So it's that's what these parents do for these kids, and it's not helping them.
Right.
Just like in sports, in my opinion, it doesn't help to give the guy who loses a trophy. No trophy. You didn't win. Win and get the trophy.
The consolation pride.
I don't believe in that. Because you're teaching them the wrong lesson.
Yeah, that's true. It's very true. It's very true.
Not everyone wins. You have to work really hard to win.
I could not agree more.
Really hard. People don't realize how hard you have to work to really win.
I know. Yeah, it's tough because I agree with you 100%, but then I also sympathize because I do see the other side where it's like, what about the people who just never win? They just have because there is a luck component to life. There's a little bit of luck. Like me and you were lucky.
Yeah, of course.
We're both lucky. We both worked hard too. Because luck by itself does nothing. You got to be prepared to accept luck. Yeah. So we worked our butts off, and that's where we're both successful, happy, and have a great life. But there are people who are unlucky.
But most people have a skill that, in my opinion, there's something that they could be very good at.
And they're not utilizing it.
And it doesn't have to be an academic thing. Some people are good at art. Some people are good at music. Some people are good at some other creative thing, writing. Some people are good at
or a technical thing. They could be a great plumber. They could be a great handyman. Yeah,
something. And if you work very hard at that thing in every different way, and you learn about business and you learn about this, like you could be good at that thing.
Yeah.
And like the examples are, you'll see, two guys in the NBA draft. One's drafted number 2, one's drafted number 3.
Yep.
And you'll see the number 2 guy. They're the same amount of talent, or relatively speaking.
Yes.
They're the same height. They can jump just as high as each other. And one practices shooting all day and works hard and doesn't party and whatever. And they are a 10-time All-Star.
Right.
And the next guy makes his $5 million rookie contract and he's out of the league in 4 years.
Yeah, very true.
And they're both equally lucky with the skill set they were given.
That's true. That's a good point. And they're just as good regardless to comparing to the rest of the world. So yeah, I agree. That's a good point. That's a very good point.
I believe in tough love, though.
Yeah, I think tough love is important, especially when you have a situation where you don't have any other way to teach in life. I think that you have to really push people to work their hardest.
That's what I'm saying. So like my patient who, whether it's depression, whether it's needing to lose weight because of diabetes, high blood pressure, heart disease,
postpartum,
I really am a little bit of a tough love on them. They know I care about them, and I do, but I push them. I push them. Yeah, that's part of the.
No, that's great.
That's part of my modern prescription. I like to push them, and people. It's like you want to be pushed a little bit.
Yes.
Normally, it's not a doctor that's doing that exactly. Normally, it's your trainer, it's your whatever. But I think that's a role for me.
I love that. I think it's great to have a little bit of a hard doctor, because you're right. The doctor is always like this soft teddy bear.
You got to lose 20 pounds this year, but they don't.
They never do.
Right.
Unless you push them. Yeah, you're so right. Because I remember even as a kid, like you'd go to the doctor, you go with your parents, and you'd see the way the doctor talks to them. They're kind of like, oh, you really should try to cut down on smoking. And that's it. That's the way he says it too. And it's like, that's it? Like you're the doctor? You're the only person that's ever going to give this advice. And you said it like that?
Yes.
And like it's almost like they're timid. They're scared to be too forceful. Yeah. So I love that you're able to be a little bit more harsh. I do the same thing with consultations for cosmetics too, because now, like, not to change the subject, but the cosmetics world is getting a little funny right now. Like people are just doing weird stuff.
Is that because of all these filters?
It's because of the filters, but also
the sparkle filter.
They want the sparkle filter. Yeah, they want to walk through it with instead of TikTok now, it's going to be Reels.
Yeah,
the Reels filter.
Yeah, the Reels.
The Reels came out today.
Reels filter.
Yeah, but yeah, we're saying weird stuff. There's like these thread lifts that people are doing where you stick threads.
What's a thread lift?
So there's threads are like made of these substances, like a plastic polymer that dissolves naturally. So it's like made of like PDLs, PDO. And basically, these are substances that are like fillers, like that you normally inject for lips and cheeks and stuff, but they're much more sturdy. So they're kind of like a string. And then you stick them in with a needle, and then you attach them inside the skin. You can pull tissues in different ways. So you can like lift the cheeks and lift the face and do things like that with threads.
Wow.
I think that they're overly
How long
prescribed.
Does that last for?
I've seen them last 2 days.
Oh, wow.
Yeah.
Really?
I mean, they're prescribed to last 2 to 4 years, but depending on the type of thread and who's doing them. But I think they're overused, and I think they're over indicated, and a lot of people are just jumping on the bandwagon.
So they're FDA approved drugs.
Yeah, FDA approved drugs and substances that can be performed by a prescriber. It'll cost you anywhere between $500 to $2,000 per thread, depending who's doing it for you.
Gotcha.
And there's different types of threads.
More expensive than it would be to just get it done once and for all. A real
facelift. Yeah. But here's the problem. The unethical part of threads is that
you have to come back.
Well, there's a lot of people doing it on younger people who don't need it.
Gotcha.
So a lot of prescribers, a lot of med spas, a lot of doctors, a lot of nurses who are doing it on like 20-year-olds and convincing them they need threads in their lips. I just saw a girl the other day who got threads in her nose.
What does that even mean?
I have no idea. I still don't know, to be honest with you. But basically they put threads in the nose.
You know everything about noses. So
I know. And to me it was the weirdest thing. I literally looked at her in the face and I told her, whoever put threads in your nose literally just stole your money. And I said it to her very bluntly.
That's criminal.
I think so, but it's just so weird that people are doing these threads all over the face. There's certain areas that are fine. I understand the indication and safety-wise, it's okay, but you should not be putting threads on the lips. You should not be putting threads in the nose. I mean, that's just ridiculous. So any med spa or any consumer who's listening, don't get threads in your nose. Not
reels,
in your nose.
But no threads.
Yeah, do reels. Instagram reels, but no threads.
Gotcha.
Yeah.
Oh, man.
Yeah, but the world's a crazy place right now. I mean, what's happening in Beirut right now is so depressing. And it's, the bomb explosion, attack, whatever you want to call it, whatever it was, that itself is crazy.
But it was already a very troubled country.
Yes. And that's the sad part. It's already such a troubled country.
Yeah.
And they're going to be reeling for this for months, years, decades, maybe.
It destroyed everything. I mean, it destroyed all the buildings around. I mean,
I know.
Not to mention their port, but it destroyed like half the city.
Yeah, and they're port dependent because they're surrounded by countries that they're not on the best of terms with.
That's saying it lightly.
Saying it very lightly. Oh, I am pro everyone. Sometimes you say something and then all of a sudden
no.
one side comes after you.
Very sad.
Very sad. And, the one thing I read was that a lot of the hospitals got destroyed. And so I saw this really powerful picture that you probably saw too.
Hospitals destroyed during a pandemic is not good.
During a pandemic, not good. And also I saw this photo where the doctors and the nurses were holding iPhones with a light.
I saw
and they
that
were all
too,
examining the patient.
Yeah,
to operate. Yeah. I thought that was so empowering.
Yeah.
Like, how cool is that?
Unbelievable.
But wow, what a time. Like, you think about that because we live in LA, in Southern California, and the big one, right? The big earthquake.
Yep.
We're all waiting for one day is going to come.
Hopefully it won't be as bad as that thing.
Hopefully not, but it could be worse technically, And that kind of scares me because natural disasters.
Have you been in an earthquake yet? You haven't been here long enough, huh?
No, not in a real earththquake. I've been in these small ones where it shakes for like 10 seconds and everyone posts about it the next morning.
Gotcha. You haven't been in the ones where like everything falls out of the cabinets.
No,
chandelier breaks.
No.
Those are crazy.
You grew up with that?
Yeah.
Right. See, I grew up in Texas where we had hurricanes. So I grew up in hurricanes.
In Texas.
Yeah, Beaumont, Texas, Southeast Texas. Yeah, Gulf of Mexico.
I guess so.
Yeah. Funny. We had some Katrina, New Orleans.
Only on that map where like Trump drew it extra far to look. You're going to have a hurricane in Florida. You're going to draw with a black pen so it looks like it hit Texas.
Yeah, that's hilarious. You had a thick pen.
Anyway, earthquakes are scary. A lot of people, what's funny is like you always get that one paranoid patient who comes for their checkup and he's like, Doc, this year, what do you think I should have in my earthquake kit?
Yeah. What do you have at your house right now? Like as a doctor?
I will admit I do not have an earthquake kit, but what you should have, I probably have all these things, just not in a kit.
Not in a kit. But what kind of stuff, do you keep stuff in your house?
Definitely want a flashlight.
Yeah.
I think if you really were planning ahead, you should put a burner phone in there would be cool.
Oh, cool.
But in terms of medical stuff, something to clean out wounds maybe.
Yes.
So like whether that's, what's it called?
Like alcohol, antiseptic.
Yeah, antiseptic stuff.
Yeah.
Some bandages, probably some antibiotics maybe. So maybe some for the skin type of stuff.
Yep.
So
Keflex I keep that at home. Yep.
And then if the world's going to be a mess, you may want some like Cipro for diarrhea or something in case the water supply is a problem.
Smart. Very smart.
What else could you have in there?
I keep a bag, and this is from surgery, like residency training, where we were on call, right? In the middle of the night, you have to go take care of wounds, take care of fractures, go take care of emergencies. So we always had, because depending on which hospital we're rotating at, sometimes you don't know the supplies at that hospital very well.
Right.
So we have a call bag. And in the call bag, we always had our gauze, our sutures, our, suturing kit. We always have antibiotics, our lidocaine, like everything always in there. So I've just had that habit. I still have that at home, and I kind of refill it once a year, make sure it's good. So I have everything I need to like repair any lacerations or injuries. I even have like this wooden board should you have like a fracture that you can like stabilize the leg and wrap it with a Curlex.
Wow.
So I keep stuff like that.
So I'll call you if there's another thing.
Yeah, definitely
My
call me.
on-call bag would be very useless. I have
Stethoscope?
a blood pressure cuff, stethoscope, thermometer.
That's good. That could be useful.
Couple COVID swabs. Not that helpful.
The COVID king always has a COVID swab.
You gotta have COVID swabs just in case. And it's in my little house call bag.
Yeah.
What else is in there? I don't know. That's pretty much it.
The main things. I think the average person though at home that's listening, I think batteries, flashlight, earthquake kit. You just buy one of these kits.
Yeah.
And then I would definitely agree with you that it's worth having some antibiotics. If you could get some from a doctor, just to have some readily available Keflex, Cephalexin for skin, and maybe like like you said, Cipro for GI stuff. But again, this is only to be prescribed by your physician. Yeah. Don't buy this stuff black market. But it's just sad looking at what's happening in Lebanon and looking what's happening with the people.
Really weird year.
Really weird year. Just gosh.
Thank God, our listeners have this show to make their lives better during this terrible year.
And just share it and subscribe and rate it 5 stars and comment.
We're already on number 8.
I know.
Kobe would be very proud of us.
Wait till we get to 24.
I know.
And if you're still listening at 24, you're loyal. You're one of our day ones.
Yeah. We just have to win the title for him now.
I know. I think we will this year. I think we will. LeBron's doing well.
Well, they've been a little shaky since the bubble started.
Anthony Davis did great his last game. Oh my God, he was LeBron the last game.
I'm worried.
He killed it.
We lost last game.
The one before. 2 games ago. Yeah, it's gonna be a shaky season, but we'll see. Yeah, and so any interesting or any cool patients lately? What's been going on in your clinic?
So, what's funny is I used to have this thing on my Instagram where I would have like the mystery case of the week.
I loved that. I used to read through them.
Yeah.
It was kind of like med school for me because I would like relearn.
Yeah. So I had a really weird case. I'm going to de-identify.
Okay.
So I don't want to, obviously violate this person's privacy.
No HIPAA.
So I had a sort of middle-aged guy who had these, basically body aches and fevers that were going on. And of course, we all thought it was COVID based on those symptoms. So he went to his outpatient doctor and had a COVID test and it was negative. So he goes back home, fevers don't go away, still not feeling well. So they just start him on empiric antibiotics. He had no focal symptoms. There was no cough, no urinary symptoms, no diarrhea, no thing to hang your hat on, no rash, just the fevers.
Yeah.
But because he wasn't, it was negative for COVID. So of course, try some antibiotics.
Right.
A few more days go by, fevers are getting worse. Another COVID test.
Wow.
Negative.
Wow.
So now he's really panicking. His fevers are going up, 103, 104, sweating, chills, but no specific symptoms still.
Wow.
So he goes to the ER. In the ER, they do a rapid COVID test, negative. So the ER doc calls me and says, listen, this is I have no idea what this is. Chest x-ray is abnormal. But bilateral, looks like COVID, doesn't look like a bacterial pneumonia. This guy has fevers, but now 3 negative COVID tests.
Whoa.
So we admitted him, and I started him on a whole bunch of stuff to lower the fever. So like cooling measures, cooling blanket, Tylenol, Advil, something called colchicine, which is an anti-inflammatory. Fevers sort of mildly go down, but they plateau at like 102 for another couple days. We do another COVID test because I was so convinced it was COVID, negative.
Wow.
So now we're at this point where this guy has now had for 2 weeks, almost 14 days, fevers, high fevers, no diagnosis. Antibiotics are not helping.
4 negative COVID tests.
4 negative COVID tests.
Wow.
So I talked to our infectious disease specialists, our pulmonologists. All these guys these are some of the smartest guys in the world.
Yes.
Cedars was just ranked the number 7 hospital in the U.S.
Wow.
So these are the top of the top guys. And we basically all agree everything looks like COVID. We got to figure this out. So they actually sent him to the bronchoscopy lab where they basically stick a camera down into the lung and get samples they can shoot water and suck out samples and whatever. Lavage is what it's called. And the lavage came back positive, COVID positive.
Wow, so, in the lungs.
So we found it in the lungs. So he had 4 negative nasal PCR swabs.
Wow.
But our suspicion was so high, we found it in the lung. And what's interesting is the way this PCR test worked, if you've listened to other episodes, I've explained this. We are looking for the genetic material of the virus, the RNA. When we get a positive swab, we, however, do not know whether that is a living virus or dead virus.
Right.
So what's interesting, one possible explanation for this guy had COVID. He turned from having COVID to essentially this immunologic state where he was having high fevers, chills. Some of his other inflammatory markers were incredibly high. His CRP was 250. His D-dimer was up. All this evidence of this massive inflammation. Ferritin was like 3,000.
Wow.
But it was all immune driven. Like the COVID may have already been dead at that point. So we don't even know if the COVID we found in the lung was really live or dead. But bottom line is that was the story. And
wow.
So the good news is we didn't give him anything. Definitely didn't give him hydroxychloroquine.
No hydroxychloroquine.
But we didn't, what's interesting is everyone's intuition, and I explain this to the family and the patient and anyone else, your intuition in medicine is always to do something.
Yeah.
But sometimes the do something is to monitor and make sure they're not getting worse without giving them something potentially toxic. So the best treatments we have for COVID right now are something called remdesivir, which is an antiviral, but can be very toxic to the liver. And the immunologic state he was in, he already had elevations of his liver enzyme. So we were sort of worried about using it unless we could prove he had a lot of active COVID. And with the negative tests, why would you give an antiviral to someone who has negative tests, even if they're in this immune state?
Right.
And the other option would be high doses of steroids, potentially dexamethasone. But because his oxygen levels were relatively reasonable, basically we just treated with, temperature lowering things, and he got better on his own.
Wow.
He's back home and
a
success. But
that's amazing.
Scary.
That's a great story.
Scary.
That's scary.
So we're seeing I've seen so many weird
manifestations
with this virus.
Yeah.
Seen people who, I've had people who were going in for a routine calcium scan to just see how the plaque on their arteries are doing, just routine tests. And then the part of the scan that catches the lung, you'll see these crazy looking COVID
infiltrates.
Lungs, infiltrates. And then you'll test them for COVID. They're negative. It means they had it, maybe even asymptomatic, but it affected their lungs.
Wow. So you're seeing asymptomatic patients with physical findings later.
What's interesting is in China, when China actually, since they have contact tracing, they don't have COVID anymore. But when they had it, the way they were diagnosing it was on CT. They didn't have good tests because it was a new virus.
Right.
So the way they were their case number is actually CT evidence of COVID. It's not actual PCR testing positive.
Wow, CT evidence. Wow, that's amazing.
Because that's how they found it. They didn't have swabs. So basically, anyone who had symptoms, they would CT them, and if it looked like it, they would call that a case.
Wow, that's insane.
Yeah.
That's an amazing case though, because it shows us that number one, if you feel sick and you think you have it,
talk to your doctor.
Talk to your doctor and pretend like you do, because you probably do, even with the negative test.
I think that's the most important takeaway.
Yeah.
Is even if you're relatively asymptomatic, even if you have a fever, if you feel anything enough to get a test, please quarantine yourself.
Yes.
And even if you think you've been exposed around people, please quarantine yourself.
Yep.
And wear a mask. And we all want this to end, but the problem is the only way this ends is if you do these like 3 basic things. Wear a mask, stand far apart from people, be outside if you're going to be around people and wear a mask, and quarantine if you think you were exposed. That's what makes this end.
Amen.
As much as I wish hydrochloroquine worked, it just doesn't. And wishing that it helps is not going to fix the situation.
Yeah, it's not.
So
no, I could not agree more.
And
and vote and register to vote.
Vote.
And if you remember, if you're voting by mail,
they may cheat you. So go in person.
Well, yeah, but good point. But if you are voting by mail, remember voting day for you is not November 3rd.
No.
It's about 15 to 20 days before.
Yes.
Because you need to mail your ballot in. So it arrives on time. So keep that in mind. But register to vote if you haven't already. It's very important.
Yeah. And share the show.
And share the show.
I think in order of priority. Definitely.
Yeah. Share the show first.
Share the show.
Yeah. Then register to vote.
Well, because then you're indirect. Then the other person is going to hear about voting also.
Right. And call your grandparents.
Call your grandparents. There's a lot of good things. Takeaways. Write down what you're grateful for.
Yeah.
And then before bed, one night this week, write down what you're grateful for. And then before you look at your phone the following morning, read what you wrote. That's
great.
Call your grandparents.
And don't pick up your phone first thing in the morning.
Call your grandparents.
Mm-hmm.
Share the show.
Yeah. And wear a mask.
And wear a mask. That's it. That's all we need you to do.
Super simple. That's all your homework.
And if you can only do one thing, just
share the show. Thanks for listening, guys.
Yeah, thanks.